Here, it's such a unique environment. I think for anyone coming into an environment, whether it be the officers or healthcare personnel, it's definitely an adjustment. Simple little things that you don't even think about becomes, frontline issues here. You can't have inhalers that can be used to stash illicit substances, that type of thing. Something that was completely foreign to me, and as somebody who's never been involved in the illicit lifestyle, I guess I came in somewhat naive. But that was the first challenge. The second challenge is that it was a new position, so we were creating something from nothing, and along with that comes growing pains, right? So every day here is certainly a new challenge. I am the one that's largely responsible for the methadone maintenance program here. So generally when I come in first thing in the morning, if there's been any new admissions overnight, because it is a 24-hour facility, we do have people coming into the center at all hours, I deal with those, so I confirm the methadone, get everything set up for the offenders to continue their methadone maintenance treatment here. A lot of the reward comes from the positive feedback from, well, not necessarily peers because I'm the only pharmacist in the building, but our healthcare team. We have physicians that come into the center 3 half-days a week. We have psychiatry coverage, we have psychologists and 24-hour nursing staff. So their positive feedback has probably been the most rewarding. It seems to have really eased the burden on them. And again, talking that I was, or mentioning that I was the only one in the building, I haven't really even had the opportunity to, practice to my full capacity, we'll say. I'm so busy doing taking care of other details and dealing with everything else that comes up that I don't have a lot of time for the clinical work. And there's a huge, huge need, as I see it, for a clinical pharmacist on site here. We have all kinds of patients, ranging from healthy young men to infirm elder people, and we run the gamut of HIV to complex cardiovascular patients. We've had people here with severe infections on IV therapy. They can't use conventional IV poles because, again, they become weapons. So we've had to find unique infusion sets, which again has been another project that I've been trying to get on top of. Simple things like we do have an infirmary where the sickest of the offenders are put so that they're closest to healthcare, and they're the most intensive, work-intensive patients in the building. We had a female in there shortly after I started that was in such bad shape with her breathing that she was on an oxygen concentrator that they had gotten for her. After 24 hours, it was taken away from her because she'd taken it apart and was sparking from the machine to light up cigarettes, contraband that she'd brought in. So, even as sick as some of these individuals are, they're still trying to do nefarious deeds, we'll say. We have to confirm everything, confirm a current prescription. Of course, sometimes these guys are on the lam from the authorities, so they'll miss 3 or 4 consecutive doses, so we can't just automatically resume their dosing as they were before. Not to mention the number of people that come in and will make allegations of certain things that they're taking that aren't necessarily true, so we can't just automatically take what they're saying at face value or initiate something that they were on last time, because in a short period of time a lot can change, especially with this particular population, and we have to make sure that everything is current and good to go.